South Africa now, where President Cyril Ramaphosa has warned of the gravest crisis in the history of its democracy. South Africa now has about 300,000 coronavirus cases, the highest rate on the continent. Schools there reopened last month, and since then, several thousand teachers and students have become infected with the virus. Poor sanitary facilities have made many of South Africa's schools a breeding ground for the virus. DW correspondent Adrian Kriesch reports from the city of Durban.
These are the teachers' toilets at the elementary school in Kwanyuswa. The women's toilet hasn't worked for years, so the female teachers have always used the students' facilities, which are also in a sorry state.
I started working here in 25 years back. The toilets were like this. We are still using the pit toilets after 25 years. I thought as we get democracy, I thought everything is going to be right in this school. We are going to get running water. I didn't see any change. I didn't enjoy working. It's only that I like this work. I like to help learners. That's the only thing which brings me to come to school, which pushes me to come to school. It's because I like to help these poor learners.
For years, she has pressed the Ministry of Education for support.
The department said there is no money to fix the whole school.
Only 3 roofs were repaired last year, and even then only partially, visiting teachers' union representatives say. The roof is not watertight, and the rainy season will soon be here. Critics say for years South Africa has suffered from massive corruption in the awarding of government contracts.
There's no follow-up. There's no accountability for the work that is done in our institutions. You just give people to go there, do the work, and then there's no one who comes afterwards to check whether everything was done according to the book before they pay. How were they paid if the work is not finished? Because you can see that it's not finished.
Trucks deliver water, but not enough. Many tanks remain empty. The union says it was irresponsible to open schools like this amid the rapid growth in COVID-19 cases. Only 2 age groups have begun classes so far, but others are to follow in the coming weeks.
The infrastructure of the school has been neglected for years. At the moment there are only few learners here, but the teachers fear that if more learners return to school, it will be impossible to follow social distancing rules.
There have been no COVID-19 cases in the school so far, but many parents walk just an hour's drive away here in Durban, one of the country's coronavirus hotspots. Despite repeated requests, we couldn't secure an interview either with the regional government or the Federal Ministry of Education.
What is the answer?
Teacher Ntombing Obo wants lessons to continue, regardless of her frustration and the pandemic.
There's no future if we are not educated. That's what we are telling them. As we are living in this country, which is like this, the only thing which can help these learners is to go to school and learn.
And despite the difficult circumstances, Obo and her students are doing all they can to protect themselves from coronavirus.
Okay, let's bring in DW correspondent Adrian Kriesch. He's the author of the report you just saw. Hey, Adrian, good to see you. So, thousands of teachers and students have become infected since schools reopened. How's the government reacted to that?
Well, the government says it still has to cater for the right to basic education for all children in the country. And they say that everybody has to adapt with this new situation, the new normal, they call it here. And for many students, this is, especially from poorer backgrounds, it is indeed crucial, not only because of the education they get at schools, but also because of feeding schemes. They get warm food there in schools, which is crucial for many families from poor backgrounds. So this is definitely another important aspect that has to be considered in this debate.
Right, Adrian, so there is a lot of pressure on the government, right, to change its response. Specifically in this case, you could talk about the unions, for example. Is that likely to happen?
Well, the minister said, the Minister of Basic Education, she will hold meetings with stakeholders throughout the week and then address the nation at a later point of time. But, you know, the society here is divided. Teachers are also divided. You have those sides who are saying, yes, we definitely have to stop it. The pandemic is in a very dangerous state at the moment. On the other hand, you have a lot of teachers who say we have to keep on living the way it is at the moment, and we can't just stop learners from going to schools, because also you have to remember that this country is very unequal. The inequality in South Africa is really enormous compared to other countries, and you have a situation whereby you have a few very good, rich schools. They were able to offer online learning, for example, in the past. They also can cope with these new measures for fighting COVID-19 at the moment much better than those schools who don't have the means, the poorer schools. And experts here believe that if only some schools will be able to operate during this time, this inequality will increase in the future as well.
Yeah, that's an interesting point. Adrian, this debate is raging as the country is recording more and more cases. As you mentioned, this is a very difficult time in terms of the coronavirus pandemic in the country. What is the latest on that front?
Well, it seems some regions prepared rather well during the lockdown. You know, the lockdown initial idea here was to prepare the health sector. But in some areas, it didn't seem to be the case. Gauteng, for example, the area around Pretoria and Johannesburg, or the Eastern Cape, they face massive challenges at the moment. A massive lack of intensive care units, for example. Throughout the country, there's a shortage of 12,000 healthcare workers at the moment. And then there is still the big issue of testing capacity here. South Africa is doing by far the most tests on the continent. But still, at the moment, when you go to a public institution, you will only be tested if you're above the age of 55 or you have comorbidities. Otherwise, there's no chance for you to get tested, even if you're sick.
Okay, that's Adrian Kriesch in Cape Town reporting on that story. Thank you, Adrian.